Hello and welcome to the WIHS Journal, Public Affairs from 104.9 FM. I'm Paul Kretschmer. Our guest on today's broadcast presents anecdotal evidence of treatment that he has performed. The opinions are his own and not necessarily those of the staff or management of the station.
Absolutely. Both significant problems in Lyme disease. What a nasty thing that is if you can track that. Just out minding your own business and you or your children or your pets get bit. Boy, that's a bad one.
Yeah. Have you encountered that yourself before then, sir?
Well, I got the Lyme bullseye rash 8 years ago and ended up in a wheelchair. And that led to my book, The Lyme Disease Cure, because I figured out a way to get rid of it. And so there's that. And then I've just written the COVID-19 remedy, and I put it up as a free online book. So, yeah, on both subjects, I've been studying them, absolutely.
I understand that those two maladies share some characteristics which might cause a person to wonder if they've got one or the other or maybe both at the same time.
Well, they do. I mean, you get that terrible fatigue with Lyme, and you can get this joint and muscular inflammation. You can get that with the COVID virus, and now some people are saying bacteria. But Lyme has some big distinctions, that all of a sudden your knee won't work, or all of a sudden you can't walk, all of a sudden you have a paralysis of Bell's palsy, or all of a sudden one side of your body doesn't work right. So there's some unique neurological things to Lyme, and you don't get the fever much, but you can get flu-like symptoms, so we could be confused by them,
I understand there's been some things that some people have confused about COVID-19 and Lyme disease and just plain outright what we call influenza or something of that sort that people often have during the winter months of the year.
There's a fair amount of influenza B and influenza A going around, and so you kind of have to watch it. Then the COVID has some unique things, though. This tightness in the chest. We feel like an anvil or a huge weight is on there, that dry cough, the fever that spikes. So a lot of people are getting those, and they end up getting the COVID. Or they have, and I've talked to people in an age group from 20 to on up to 75, or they have they're diagnosed with a swab, or they might just be presumptively sent home to quarantine, and they've got pretty much all the symptoms. But they've all recovered. I've been given some advice on what to do, and it's working.
Okay, some people think that encountering something like COVID-19 is something that medical professionals would want to test for, and then I've read stories in places like the Wall Street Journal where writers who work for the newspaper there have had the symptoms, and for one reason or another, they were not tested, and they ended up staying at home for the recommended length of time and recovering in the end anyway. But they never did they didn't have anything on paper that said definitively you had the disease.
Yeah, no, it's true. There's only so much testing to go around, and a lot of people, presumptively you've got the symptoms, you stay home, you stay away from contacts. You've got diagnosis both ways. And also there's false positives, some false negatives. The testing is new. But it's, as I talk about in COVID-19 Remedy, which I'm offering as a free download for your listeners for now until I print the book, is that there are 5 symptoms that are really very standard. And, the loss of taste and smell, you don't get that much with the flu. It does, but not the fever that spikes, the dryness of the cough, the terrible weight on the chest, and the malaise. Those are pretty common. And I'll tell you the biggest thing with this disease is that some of the people I've worked with, some of the younger ones, they thought they were going to die. So it's a little different than the flu that way.
Yeah, I've had the flu before myself, and believe me, there was 1 or 2 times at least when I almost felt like I wanted to die, at least for a little while anyway, because it was so uncomfortable.
It could be that swine flu from 2008 was a bad one.
I remember.
Yeah. So
now, as far as the tests that are available, what would you say as a medical professional regarding the accuracy or the believability of the testing that's available?
Well, I think it's presumptive, like supportive. You've got the symptoms, you go get the test, you happen to be positive. Obviously, with Lyme, you've got the couple of really good tests, which is mainly this IgNex. And if you show positive with that and you've got some symptoms, you've just got Lyme.
Yeah.
But, I think it's okay. Not perfect. This stuff is new for COVID.
Yeah.
Everything's new.
Yeah.
A lot of times the medical profession is doing weird things like turning people over their stomach, obese people, and they can't breathe, because they can't breathe against their diaphragm, doing respirators, which are 90% fatal, not too good odds, giving people steroids. They don't know what to do. Steroids and the drugs make the patient worse. So it's a real serious thing. If you end up in the hospital, you got a strong likelihood of complications. So, you don't want to get this disease.
I could understand for a while, watching the news reports coming in from the various agencies, a lot of talk about respirators and a lot of talk about we won't have enough.
Oh, yeah.
But honestly, for the past several weeks now, I don't think I've heard anything about that at all. It's like it came up on the radar screen and kept on going and then floated back off on the other side of the radar screen.
It did, because 9 out of 10 die, or 10 out of 10. And, of course, $40,000 insurance reimbursement for a respirator, a lot of stuff going around there, and immediately intubating and respirator. We should be a little more conservative. I've been conservative with all the cases, and I've helped people get off the respirator, off a double pneumonia, just with conservative natural treatment. No respirator, no steroids, no drugs.
And what would be, if I may ask, some of the parts of what you've done with people that you could mention to our listeners now, as far as what you've done for patients?
I tell you, the biggest thing is a natural medicine that kills germs, viruses, everything, just something natural, and that's the oil of wild oregano, which is pretty popular in the health food stores, the wild one. And I tell them, just take, if they're just mild, 5 drops 3 times a day or 4 times a day. If they're having problems and they don't want to end up in a hospital, or if they're there and they want some help before they go under respirator, I might tell them, have you ever heard of wild oregano, by the way?
Yes.
Okay. I tell them to take 20 drops of the really good quality wild every half hour or every hour. And there's another supplement called Oregaresp, which we tested, by the way, against corona and influenza A. And if it's a capsule, I tell them, get that, take 3 capsules every hour, or 3 capsules 3 times a day. And, between that, by the way, Oregaresp is cinnamon, cumin, sage, and oregano. Mm-hmm. And the other one is the oregano oil. Interesting, isn't it?
Yeah, it is interesting.
Yeah.
How often do you find situations like that where something that may actually be readily available is overlooked in our haste to come up with a new and improved version of whatever we think we can figure out?
I see it constantly because, we don't believe in the pharmacy of nature and medicine. We've neglected it. Actually, the homeopaths and the herbalists were wiped out by the drug cartel back in the 30s. We've never had a chance since. So when something like this comes, like Lyme or corona or influenza epidemic, we don't have any tools. We don't know that you can eat garlic and onion and it would help you and you would not get the complications. Just that alone would help. What's going to survive eating a bunch of garlic and onions?
Right.
So we don't know about oil of oregano. When I did the study, and I published that, and it was found online in about January or February, so people started to post it on their Facebooks. My study, I didn't post anything. And Twitter, Facebook, and Google suppressed it, changed the algorithm so it went dead. Why would you do something like that? Let people look and see what there are some options that they could take as a prevention, as a natural medicine. No, they don't want anything to do with this.
It occurs to me that something that might be considered naturopathic often is lumped by some people in under the phrase old wives' tale, which is kind of a code word for skepticism or nutcase or something like that.
Yeah, and what we did was we published an antiviral research, and that is to take a cell culture and make 5 million coronaviruses per centimeter of blood and 10 million influenza A and 5 million bird flu. Bird flu is 50% fatal. Then we added the spice oil, the oil of wild oregano, super strength, and it killed all the viruses to like 99.999% in 2 minutes, 1 dose. Even we were able to kill the bird flu, 50% fatal. So I think we should kind of look at this and evaluate whether or not we could recommend to people, increase your vitamin C, increase your citrus, look at the leek and garlic and onion and shallot family for your family, have more in your soup. Use more cinnamon. Our research was on cinnamon, too. If you can find oil of oregano, juice of oregano, orega spray is also interesting. Listen to this. Case history. The guy was set to go on a respirator, the gal, actually, a physical therapist. She called her friend and said, I'm going to die. The friend controls her. She's a practitioner that controls nurses. That's her business. She ushered in a bottle of wild oregano bay leaf spray and clove. It has clove in it. She sprayed it on the back of the woman's, on the back of her throat 4 times. The doctor came in and said, your oxygen profile is better. We're not intubating. 3 days later, she checked out and went home. Now, it took a while to get perfect, but what happened there? What kind of disease are we dealing with? Maybe it's a bit of a wimp when you hit it with something. Even the Trump was saying, "Hey, I'm taking zinc. I'm taking hydroxychloroquine." What's he? He's trying to do something. But of course, this is a far step. This is 4,000 years of human use. The Old Testament's interesting. I don't know the scripture that well. I'm the oregano expert. It says, "Look, why don't you clean yourself out with my hyssop that you'll be purified, white as snow." Well, turns out that hyssop is oregano oil, or oregano from the mountains.
Well, there you go.
And why did the Romans give you a sack of gold if you gave them a sack of cinnamon? They knew something.
Yeah, there's some value there, and they recognized it.
Yeah. And the same with Lyme disease. That's why I wrote the book, because we're finding that, and Zhang and Johns Hopkins found the same, that we ought to give the oregano oil, the cinnamon oils, and we ought to give them a look. They kill in vitro the spirochete. They eat the biofilm. Patients are using them, and they're getting some benefits.
Well, I remember hearing some of the words that you're using to describe the Lyme disease problem, because I can remember a relatively long time ago visiting the Connecticut Agricultural Experiment Station near New Haven, Connecticut, and hearing about this disease which had been identified, and some people were still referring to it by other names, or because some of the symptoms resembled or looked like the symptoms from other things, like arthritis, for instance. I think. Oh yeah. I think
rheumatoid arthritis too.
Right. Right.
And MS, Lou Gehrig's, Parkinson's, tremor.
Yep.
Can you imagine a single germ could cause 15 big illnesses?
Yeah.
It's so bad that Connecticut has this challenge, and how you can't even go out anymore without some concerns. Now, one thing that might help is we found that people who take, not to harp too much, but you got to know, people who take the wild oregano oil, the P73 is the one we recommend that is out there and is definitely wild, they don't seem to get much tick on. Somehow, the prevention. If you take and spray it on your body, you get a protection, less ticks on dogs, cats, and yourselves. So there's a little hope under the shadows there. Yeah,
it does seem to be a prevention thing more than anything else, as far as I can see right now in Connecticut for the last number of years, is rather than trying to concentrate on treating the symptoms or the malady when it develops in someone's body, we're pretty focused on trying to keep the ticks off of us in the first place so that we don't end up having to deal with it at all.
Oh, I think that's the way to go. I mean, you just don't want Lyme disease. I've had to help so many difficult cases. And the dosage of the natural medicines, because you can take the antibiotics, that's one thing. If you don't want to, you don't want to, is just huge. Like the wild oregano oil and the Oregaresp. Sometimes we'll give like 9, 12, 15 capsules a day. That's crazy stuff. And 40 drops 10 times a day just to help them, like an antibiotic effect. Which you can also take the drug and take the natural medicine simultaneously. So we're not saying don't do the medical. This is just sort of what we call alternative approaches.
Thank you very much for your time, sir.
It's been a pleasure.
For further information on what you heard on today's broadcast, call us at 860-346-1049. 860-346-1049. The opinions expressed are those of the guests, not necessarily those of the staff or management of the station. I'm Paul Kretschmer on the WIHS Journal, Public Affairs from WIHS, Middletown.